Okay, so when you look,
Yeah.
that's you.
All right. Welcome, everyone to Bruh. Let's talk about it. A podcast about men's health. I am your host, Deirdre, and with me, my co host.
Hi, I'm Antoine, and bruh, let's talk about it.
All right. And we are going to take a dive into a, a concern that a lot of men have and are dealing with, which is prostate cancer. Today, we have with us a guest, Dr. Donna Patterson, who specializes in cardiology. However, she also has a lot of information for us today about prostate cancer. We're honored to have you, Dr. Donna. Introduce yourself for us.
Thank you so much for having me, Deidre and Antoine, and all the members of this group, this team. My name is Dr. Donna Patterson. I'm a board certified nurse practitioner. I'm also the owner of Rejuvenate Health Med Spa, where we specialize in helping women lose weight specifically. That's our main focus. And I also work with cardiology at the hospital, in a hospital setting.
All right, great. Well, thank you. And again, we're so happy to have you here today to talk
Thank
about
you.
this topic.
Yes.
So when we talk about prostate cancer, just tell us, what is it actually?
Prostate cancer is one of the main form of cancer that affects men, and it is not talked about very often, and that is why it is so important that you're having this way of bringing attention to the subject to the men population, especially because most of the times we focus on the women,
Right.
breast cancer and cervical cancer and all the other stuff that affects women
So true.
and men too, but specifically prostate cancer affects only men, and or I would say the majority men.
Mm-hmm.
It affects only men, but men have a problem with being diagnosed early, and that's where the problem comes in.
Okay. So,
And
Antoine.
just for those of us that may not know, what is the prostate, and how does that become affected? What's bad about it? Because I
Great
feel like
question.
we hear words like, "Oh, prostate cancer," but we
Hmm.
don't actually have a good understanding, oftentimes, of what exactly is that.
Right.
All right, so he comes with a hard hitting question right out the gate. Well, the prostate is it's a small organ that sits right between the bladder and, of course, the ureter, which is the vessel that transports urine from the bladder. The prostate sits right behind that.
Mhm.
And it is basically separated from the bladder by a very thin layer, like a thin sheet.
Right.
So you may hear of someone that has an enlarged prostate for whatever reason, and now their stream is affected, their flow. They're not able to urinate properly.
Mm-hmm.
So the prostate, it's very sensitive to changes in the body that is happening. And if that gets enlarged, it blocks the flow of urine from the bladder out through the ureter.
Yeah.
So it doesn't necessarily, it sits there, but it doesn't necessarily serve a purpose for the most part until it goes bad. It's like your appendix.
So one of the things that I was also told is that it actually helps shoot the actual sperm during an ejaculation. So
Oh.
yeah.
You see, this is the thing. He said, "Oh,
Yeah, exactly.
because even though men have the prostate, they don't really know what it
what
is,
it does,
or what it does,
exactly.
or what the functions are." Yeah,
Right. And like you stated, once it goes bad, then that's when, there's
there's
a
a.
problem.
Mm-hmm.
Being a nurse, I do recall a time where there was a man who needed a catheter,
Mm-hmm.
and just trying to thread that catheter, which is often, it comes easy to me. Is, I can
Oh
do it with
yeah.
my eyes closed. However, with this individual, his prostate was so enlarged
Mm-hmm.
that I wasn't able to. And the yell that he, gave out, you can just feel his pain.
You could hear it down the hall
Exactly.
in the hospital.
Exactly.
Really,
It's such a painful experience for
it is
men.
very painful. And men, of course, they don't tolerate pain. Most men,
Mm-hmm.
they don't tolerate pain very well.
Except tattoos.
Except for tattoos.
Even
Exactly.
tattoos for me.
Exactly. So, as she mentioned, one of the function is helping with ejaculation, and so men have a problem with people touching their men parts, whether it's a man, another man, or even a woman. It makes them very uncomfortable, and as a result of that, they don't get annual prostate checks. So, hence, we have prostate cancer being diagnosed only when there's a major problem happening.
Right.
Now they cannot urinate, they need a catheter. Why? Why is that? And then after further investigation, oh, by the way, you have stage 5 prostate cancer, which stage 5 is the latest, the most dangerous form, because the treatment options are limited at that stage. There's you have stage 1, 2, 3, 4, 5. So once you get to 5, you're literally at the worst stage.
So let's talk prevention. What is something that men can do to prevent it? Antoine mentioned to us earlier that he's in the. Are you a millennial? Or Generation
I am
X?
a millennial.
He's a millennial.
I'm a millennial.
I can't keep up with these Eliels.
Right. We're Generation X's.
Yes.
All three of us.
Exactly. So as a millennial, would this be something that he needs to consider now?
Oh, absolutely.
Okay.
Because awareness is the key. So whether or not you're affected by it now, being aware of that when I get to this age, and the magic number is 40. Once I get to the age of 40, this is something I need to pay attention to. But not only just that, men under 40 have been diagnosed with prostate cancer.
Wow.
For example, if it's in your genetic pool, your grandfather down the line, your dad may not have had it, or your grandfather may have had it, or even your great-grandfather, and you may not even know anything about it. But if you're even concerned that someone in your family may have had this, it is better for you to talk to your doctor, even at an earlier age before 40, to make sure that you are staying abreast, that they're checking your PSA number, and that you are aware of any changes happening in your body. If you realize that your stream is going left or going right, or not coming as it should, then you absolutely need to have yourself checked out.
Good point.
I would never think, if I did have any of those symptoms, I would not think about, I would just think, I need to drink more water. I would just come up with other alternatives as to what may be going on. So I think that's interesting. I was sharing with Deidre kind of offline. I do have a family history of prostate cancer, but it's not, nobody ever talks about it from a prevention standpoint. It's almost like one of those things where you may get this at a certain age, and it's just something we have to deal with. I don't ever hear the men in my family talking about getting their prostate checked out. I know I hear a lot of myths about what that exam process is.
Myths. You haven't even had one yet.
I haven't even had one.
But those myths scare you, though, right?
It does scare you. Well, I think it makes you uncomfortable. And it just is uncomfortable, even in going to the doctor. A doctor has never asked me if I've had a history of prostate cancer. A doctor has never offered to do a prostate exam. I think I shared with Deidre that I read somewhere that if you do have a family history of prostate cancer, that it's like around 30 to 35 that you should
start getting looked at. Absolutely.
Definitely. So what would make a man uncomfortable? Let's talk about the actual exam. It's okay. We're just going to dive into it. No pun intended.
That's a good one. Well, first of all, before we even get into that, prostate cancer affects more African American than it does Caucasian men. And the incidence of prostate cancer has been increasing every year by approximately 4 to 5% every year since 2011, since they've been tracking it. And they're finding that more and more men are now being diagnosed with this at an earlier age than prior. And it could be because we have more technology now, and we're able to screen men earlier than back in the days. So the exam, getting back to your question, entails basically the man has to drop his pants and bend over. It may be uncomfortable because the doctor or your provider will have to insert their fingers, which is these 2 fingers, into your rectum. And they're basically touching or rubbing their finger over that prostate to feel the surface of the prostate. Is it smooth or is it rugged?
Peter's sweating.
No, I had it done. So yeah.
So you know what I'm talking about.
I do.
Exactly. And it's very uncomfortable, but it's
Mhm.
necessary.
Yes.
Us women don't like going to the
I actually laid on
gynecologist.
my side though.
Yeah.
You
yeah.
can lay on your
Yeah.
side. Depending on your provider, they may have you lean over a chair. It all depends.
That seems a little
Invasive.
right.
It's the same thing.
All of it is.
It's all invasive, but us women, we don't like going to the gynecologist.
Mhm.
We don't like having to go through what we go through during childbirth either, but it's necessary. So, yes, men don't. And from your perspective, I would like to know, what are your thoughts on going to the doctor and having this invasive procedure that you consider so, they're crossing your circle of safety, so to speak.
I think I would be open to it. I think that I would need to feel comfortable with that provider.
First.
Mhm.
Yeah.
I think that's the key for me. Just that relationship and
Yes.
someone that's
Mhm.
going to explain what that process is.
Right.
Someone that's
Mhm.
going to, so to say, kind of ask permission throughout that process,
And
so that
talk
I
you
do,
through it.
so I
Mhm.
do
And
still feel like
Antoine,
I
for
have
me, it was a
autonomy.
little uncomfortable just because mine is a female.
Oh.
Right.
So,
So yeah,
yes.
it was a little uncomfortable, you
Oh,
know.
absolutely.
But you're familiar with her.
Right.
so-
Right. I've
And-
never had that experience with her before, but yeah. Like,
And-
take me on a date first. Jeez, like, can buy me a drink.
Buy me a
Buy me a
drink.
drink.
like, can you date me first?
Exactly.
But that's the thing too, because men don't like women to see them in a vulnerable position.
Right.
And so even my own husband, we may get to that later, but in me encouraging him to have his prostate check, and he just did not want to go. And he's, I go to this doctor, I'll get through to him. But it's been over 8 months and you still can't get to the doctor.
Right.
And I said, well, let me do it then. If you don't, I'll do it for you. He was like, heck no. You are not coming anywhere near there.
I don't care how many letters behind your name.
Come on. And I'm your wife.
Right.
So who are you going to trust to do this? But they don't like females seeing them in that vulnerable position or thinking of them in that vulnerable position. And that's just one aspect.
Okay.
The knowledge part too is secondary, because where there's lack of knowledge, the people perish, right? And so we perish because we are not educated enough about this. Just speaking to one of your co-hosts, your
One of the creators.
yes, out here, I'm saying that it is so important now that the information is being spread, because the Gen X's and the Gen Z's are more open-minded to getting checked and going to the doctor, whereas the older adults in their 60s and 70s, they will work all day and they'll be passing out and they won't tell someone they don't feel well. And because men are taught to be strong, they're taught to be brave, they're taught to not show their vulnerability. And so even when they're sick, they won't even tell you. And just to piggyback off of that, I've had patients in the hospital. I'm like, what took you so long? And the wife would be there, like rolling her eyes, like, I told you should have gone in. I told you need to go. And the man just wouldn't, because he's like, I just thought I would lay down. I just thought I would feel better. And this will continue on and on and on. And multiple patients, not just one. I see it all the time. So, yeah.
Okay. All righty. Well, thank you so much, Dr. Donna. We're going to take a quick commercial break.
Awesome.
And when we return, we will talk a little bit more about prostate cancer and kind of get into one of your true specialties.
Okay. Sounds
Alrighty.
great.
So,
Thank you so
bruh,
much.
let's talk about it. All right, all right, all right. Welcome back, bruh. Let's talk about it. So today we are talking with Donna Patterson, Dr. Donna, and we're talking about prostate cancer, specifically a prostate exam.
Yes.
We kind of touched on those uncomfortable situations.
It made me sweat.
Me too.
Right, him too. Dr. Donna got a little down and dirty with it. However, we did learn that prevention is key.
Oh, and knowledge.
And knowledge.
Knowledge,
Thank
absolutely.
You. So, bruh, let's talk about one of our segments, which we call "What's Happening to Us, bruh."
Bruh, what's happening to us? So I feel like oftentimes I hear about prostate cancer a lot in my own family. Why is it that prostate cancer disproportionately affect African American families versus other family dynamics in other communities?
Well, there are various reasons, of course, why prostate cancer affects the African American community more. A lot of it has to do with our environment. It has to do with our health care system, our health insurance. The type of work that some men do exposes them to a higher risk of prostate cancer.
Wow.
So,
Like what kind of work is that?
well, hard labor. A man that is out there in the field doing hard labor, and for some reason, it has not been specifically identified to say this is the cause.
Right.
Because
Is that because amino acids that aren't released, or
no, not at all.
Mhm.
Amino acids are a building block of your system.
Right,
They're
but-
proteins.
right?
So
No, I'm just asking because, like, why is it that a man that's out there working hard, he's more at risk?
think about it, the environment that we grew up in. The
Mhm.
African American community, our environment sometimes puts us at a higher risk of certain disease, for example, cancer. And so, male who are out there doing the hard labor, they're exposed more to the environment. And I cannot necessarily say, well, they're in the sun and that's the cause of it. But I do know that environmental factors plays a huge risk in the cause of cancer in a lot of men, people in general. So that is why us as African American, we're more prone to it. One, we lack health insurance. We lack proper care.
Mhm.
If you have something going on with you and you go to the doctor, you may not necessarily have the funds or the insurance available to treat that thing. You may get a Band-Aid and you go home,
Right.
but it's not helping to take care of the problem.
Exactly.
Prostate cancer in this particular thing is not preventable because they have not found a way of preventing the cause of it, but it is treatable, and it is especially treatable if diagnosed earlier.
Mhm.
So that is why we say prevention is cure, and prevention in this case means early treatment, early detection, early diagnosis. Just making sure that you're staying on top of your health.
Right.
You're staying on top of your annual exam, just like breast cancer.
Mhm.
Sometimes it's genetics. I didn't touch on that, but genetics also play a big role in
Oh
prostate
yeah,
cancer.
in any cancer.
In any cancer.
Right.
So
And-
just like if we were to say a woman has breast cancer, how can we prevent it? There's no known prevention for us getting cervical or breast cancer, but there are certain things that we can do to not expose ourselves as much.
Right.
That would lessen our risk, so to speak.
Exactly.
So in this case, where it comes on to prostate cancer, it's more so this is happening to us. Let's talk about it. Let's educate ourselves. Let's make sure that we're
Bruh.
getting the
Exactly.
Let's make sure that we're getting the early diagnosis, if
Right.
be, because like Antoine was saying, if it's in your family genetics, now
Mhm.
instead of waiting until you're 40 to go get checked up, now go ask your doctor for this.
Right.
Because a lot of times you go for a physical exam, they don't just do the broad spectrum of everything.
They're
that
not,
no,
yeah.
they do the basic, and they said, "Oh, you're fine,"
Right.
but they're not checking the PSA levels, and they're not checking the A1Cs, and they're not checking
Mhm.
all these different your thyroids and all the different things to make
and
sure
just,
that
and just to add into that, when we talk about the African American community, or getting this at a disproportionate rate, we look at the fact that maybe they don't even have health care or a primary doctor. You and
Absolutely.
I, we shared the same experience in the emergency room,
Mhm.
where people would come into the emergency room as if we were their primary care.
all the time.
And the emergency room doctors are not going to do a PSA test.
Oh, not at all.
They're not going to check your prostate. you know.
They're there for emergencies only.
Exactly. So,
Hmm.
we use the term treat them and street them, right? So we're going to just
Yeah.
treat the cause, what brought you in, and then we tell you to follow up with your doctor.
And
And
they'll be in 2 days later. Again,
exactly.
you know them by name because this is where they go. If their head hurt, they come in. They don't have health insurance. They don't have a primary care doctor. So even if someone want to go get checked and they want the help, sometimes they don't
They
have
can't afford
means
it.
and ways of getting it.
Right. Okay. Well, just, we have a few minutes left. So just briefly tell us about your other specialty, which we know affect African American men as well, cardiology and heart
Oh,
disease.
absolutely. So I specialize in cardiology now. I work at Piedmont Hospital, and I see that because men don't like going to the doctor, and this is a big problem. It's lack of education. We're finding that a lot of people, a lot of men, even in their 40s now, are coming in with heart disease and heart attacks, congestive heart failure, and it's because where they're not getting the proper treatment from early. It's not being caught early or
Early
diagnosed early.
detection. Yeah.
Diet plays a huge role in what happens to our heart. High blood pressure, which is called the secret killer because it leads to heart attack, heart failure. High blood pressure, a simple thing. A man will have a high blood pressure and he would not go get it taken care of. One, he doesn't want to take the medication because he heard from somebody's bro down the street that it causes impotence or it causes erectile dysfunction.
Right.
So the goal is here not to be on the medication. The goal is to have proper health lifestyle. Proper lifestyle that will prevent you from having to be on a blood pressure medicine because these are preventable. Diabetes, heart disease, high blood pressure, high cholesterol. The list goes on and on, but those are like the top four: obstructive sleep apnea, obesity, which is a major factor in society. Obesity is now an epidemic. Okay. So these are all things that are affecting men that would need to be addressed at some point.
Excellent.
One of the things I'll say really quick, I shared in another segment that I have hypertension and I was adamant that I did not want to take the medication.
Right.
Not particularly for those reasons, but those were contributing factors.
Right.
But one of the things that I found that was helpful was I started running. And I shared that I run 2 miles a day, 5 days a week.
Oh, wow.
And that was really, along with some food choice changes,
Lifestyle
but that
changes,
was
yeah.
the biggest thing. So I
Yeah.
definitely support that's very helpful.
Excellent, excellent. Well, thank you very much, both Donna and Antoine,
You're
for
very
sharing
welcome.
that. So now we've learned, that there's some modifiable things that we can do.
Oh,
right?
absolutely.
As opposed to the non-modifiable, which is maybe your heredity. There's nothing you can do about that, but you can exercise more, like Antoine
Oh,
mentioned.
absolutely.
Make dietary changes. So we appreciate that. So that actually ends this segment. I know we can go on and on. This is such a great topic, and we thank you
Yes.
once again, Dr. Donna,
Thank you so much for having
blessing
me.
us with your presence.
Thank you.
And
Thank you.
also,
You're very
this
welcome.
episode was sponsored in part by Rumors in Jonesboro, Georgia. Thank you all so much. Bruh, let's talk about it.
Bro, let's talk about it.
Yay.